Hey friends, welcome to the channel Health Tricks and Tips in English, the best pregnancy centric channel. So today's video is all about early water breakage, that is known as PPROM, and it stands for Preterm PreLabor Rupture of the Membrane. And this is actually the water breakage before the 37th week of the pregnancy. And if it happens to you, it is a serious condition and you should visit your doctor as soon as possible. So let me delve you more into this topic. You can see this image and you can see that the baby is turned upside down. That is, the head of the baby is fixed to the pelvis region. So it is almost the ending of the 8th month, because by the end of 8th month and usually between 35 to 36 week, the baby should come in this position. So here we can see that the baby is surrounded by the amniotic fluid. In the blue you can see the amniotic fluid, and the outer skin is known as the amniotic sac. So due to some reason that I will be telling you later on, this amniotic sac breaks, and due to which the amniotic fluid comes out from the cervix. So this is known as the water breakage. But the thing is that if this is happening before 37th week of the pregnancy, then this is the serious condition and you need immediate attention. Whereas the percentage of this early breakage of the water is very slim. It is almost like 3% to the 5% that we have seen in pregnancy that PPROM happens. But if it is happening, this need a proper attention. Let me tell you some of the reason responsible for this PPROM. The number one thing is that if you have direct impact on your stomach due to any sort of accident, then there are large chances that this can happen. Number second thing is that if this is your second or the third pregnancy and earlier you had PPROM, then there is a great chance that this time also this PPROM can happen. Number third reason is that if in your pregnancy you had vaginal bleeding, then the chances of PPROM increases. Number fourth thing is that if you have experienced the placenta abruption before, then again the PPROM chances increases. The fifth reason becomes if you have a short cervix. So due to the short size, it becomes susceptible to breakage. Number six reason is that if you are having more than one baby. So due to more babies, there is more pressure on the amniotic sac, and due to which it can rupture. And the last but not the least is that if there is more than required amniotic fluid in the sac, that is, you are facing the problem of polyhydramnios, then there is large chances of the water breakage before 37th week of the pregnancy. So in any case or in any reason, if you are having this PPROM, you need to visit your hospital or the doctor as soon as possible. And upon reaching there, you would be diagnosed if this is really a water breakage or not. And if it is water breakage, then you have to be there for at least 1 week, and within this 1 week the monitoring would be there. You and your baby would be continuously monitored for the heartbeat, for the temperature, and for the infections. To avoid any sort of infections, you would be given antibiotics, because the main motive is to prolong the baby inside the womb so that the baby can develop properly inside the womb, because still the development of the lungs and the brain is going on, and the main purpose is just to land you on the ninth month, because once you are in the ninth month, it is very much easy to take the baby out in a very good position or in a healthy situation. In case you're not diagnosed with the water breakage and it is confirmed that this is not PPROM, or in case this PPROM is very marginal, then in both the cases you would be sent back to the home. But definitely you have to keep track of this problem. So anytime if you are facing this problem, be it before 37th week or after the 37th week, you have to visit your doctor as soon as possible. Now the question comes, how would you feel that this is the water breakage? So this is something, it depends upon individual to individual. Some people may feel it, some people may not feel it, but ultimately you would feel that the water has come out. So due to the dampness of the cloth, you will realize, and if you will see it, it will be a watery type of thing. It could have a color like yellow, or if it contains blood, it will be pinkish, and it could have some smell as well. So what you need to do is right away you have to put a pad, but try not to put a tampon, because upon reaching the hospital, the medical people over there would like to see the amount of liquid that has come out and what was the color and whether they will smell or not. So friend, this was all about PPROM. Hope you have liked this information. If you like it, do not forget to press the like button. If you are new to the channel, also subscribe us so that you get notified of the further video releases. Thanks for watching this video. Let's catch up in another video on pregnancy. Till then, stay happy, stay healthy.